To me, so I don't know if you would call it a controversy, but to me the most exciting, the most challenging, and what we truly want to challenge is the existing way of treating patients. Because I'm firmly convinced that with this new immunotherapy, and I'm particularly talking about bispecific and cell therapy, CAR-T cells, but possibly other immunotherapy in development, some ADC, some fusion protein, etc. I'm firmly convinced we can completely change the way we treat patients, the way we think, the clinical trials and the drug development, and in the end for the good for the patients. And I'm giving you an example to kind of put some more precision into what I'm saying, is that we have always said that, for example, triplet was better than doublet. So if I had to create a clinical trials, I would create a clinical trials where I take the doublet drug, I use that doublet drug as a backbone, I add my drug, and I demonstrate that if there's any difference across the two arms, it is my drug, because that's the only change I've made. But anything else would be the same. I think this is completely outdated, and I think we should not do things anymore like that. We should replace drugs. We should stop the treatment. We should seek for stopping the treatment. Of course, cure, but stopping the treatment and changing drugs. And if there's a drug to change, but change a drug that is more toxic. And being respectful to the toxicity the patients experience with treatments. And for a certain degree of development of these bispecific and CAR-T, which I think are so great drugs and much more promising than we even think about with the preliminary result we've had in recent months, I think we could completely change the way we treat patients. I think with these drugs we can have so many more patients in complete deep control of the disease, so we could think about creating clinical trials, and that include the company, the pharma company, to stop the treatment, to be maybe less costly. I know we live in a world where the company and the private practice needs money because you have to invest, but yes, maybe sometimes you could invest into stopping treatment, even though that makes less money in the end. But it's better for the patients, and it's maybe just better for everyone, for the governments, for who pays, whoever pays, insurance in the US, governments for the rest of the world, etc. So I think we could better rethink the entire treatment paradigm, including the way we develop the drugs, and it is not what I see in the drug development. We use the same way, but we just forget, I think, that these drugs are much more valuable than that and could give us much more than what we have. I hope, at least. So I think I wouldn't say it's a controversy, I would say it's a problem, but maybe there's a controversy here, and we haven't talked too much about that here at COMy, but in the months to come, possibly we'll be able to voice this, and the company to discuss with us about that, hopefully.